Hi, Blood Talk fans. Thank you for staying with me until now. We will continue on our journeys. At this point, you would already have a pure culture with isolated colony. I'll treat you like a new CLSS, so the approach to identifying organisms may look familiar to you in microbiology class. In clinical, we know the source and the collection technique, and experienced CLS know common pathogens, organisms isolated from those sources already, and those experiences play a huge role in identifying organisms. This is why CLS train of thought in approaching ID is different from the classroom. If I have given you a list of biochemical tests and the results, that's pretty boring. Instead, I'll walk you through the scenarios. Without further ado, let's get into it. A 25-year-old female presents in urgent care with a frequent and strong urge to urinate, and the urge doesn't go away after urinating. Patient also mentions a burning sensation after urinations and strong urine odor. A doctor ordered urine assay with reflex 2 culture amongst other tests. The urine analysis test results are as follows: high white blood cells, leukocyte esterase positive, nitrate positive. With this, the urine culture reflex is performed. It is important to know that the laboratory will not automatically perform urine culture even with the same urine analysis test results if the doctor only orders urine analysis. This is to prevent insurance fraud. Laboratory cannot just add any orders without physician's order. In some hospital, we would call the doctor, let him know the results or the findings of urine analysis, and ask the doctor if he wants to add on a urine culture or not. But since this is a reflex test, we would continue and perform a urine culture. Step 1. Read or examine the culture plate. I already explained how to read a plate and subculture in the previous video. Now you have a pure culture with isolated colonies that show growth in both BAP and MAC. You'll have to examine the plate again, make sure you have a pure culture, because if you do not have pure culture or isolated colonies, you will have to subculture it again. However, a seasoned CLS may perform ID and SENSI tests without subculture if he or she have enough well-isolated colonies to work with. Step 2. Take a note of colony morphology on each media type. Look at the colony morphology again and note unique characteristics such as colony colors, shapes, and odor. Since I'm feeling generous, I will just give it to you here. BAP plate. The colony are flat, opaque, circular, and low convex. The color appears to be grayish to white. The colony looks smooth and moist. This is not all. One more thing that you should keep an eye out for is hemolysis. For these organisms, there's no hemolysis. Moving on to MAC. Remember, this is a selective and differential media. Knowing the property of each media would be very useful here. On the MAC plate, you see flat, dry, pink colony surrounded by a darker pink area. The dark pink area is from precipitated bisalt, which is a byproduct of fermentation. The colony have irregular shapes. However, you need to be careful because yeast can grow on MAC as well. But the morphology should be able to help you, more or less. With that being said, this organism grows on MAC plate, plus colonies morphologies, you know that it is a gram-negative bacteria. Would your next step be gram stain? The answer is yes, no, I don't know, we'll see. While looking at colony morphology, most seasoned techs would have some idea of what organisms they are trying to ID. It is always a good idea to double check with gram stains whenever you're in doubt. But a lot of the seasonal techs will not do a gram stain at this point. Step 3. Perform spot indole test. The result is positive. Step 4. Perform PYR test. That is it. That's all you would need to do for biochemical tests to ID these organisms. For the results of this biochemical test, you would conclude that the organism causing UTI for this patient is a good old E. coli. Blood talk fun time! You may notice that we did PYR test. The PYR test is not necessary for beta hemolytic strain of E. coli because our organisms in this case study is a non-hemolytic strain. That's why we need a PYR test. And why do we perform PYR test? We do this to distinguish between E. coli and Cetobacter bacteria. Some Cetobacter bacteria are Indo-positive, non-hemolytic lactose fermenter that may be confused with E. coli. That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!